by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show for Tuesday, October 16th. We're going to be talking a lot about the heart this evening and cardiology, and even I think we're going to learn a new term because I haven't came across this specialty before, invasive cardiology. So without further ado, I'm going to welcome to the program Dr. M.Gardner. He's an invasive cardiologist with Jupiter Cardiology Group and Tenet Florida Physician Services. Dr. Gardner, how are you doing this evening?
Doing great. Thanks for asking.
And thanks for driving up all the way from the Jupiter area, or driving down, I should say, to Boca. But we're on up there, so we really wanted to have you in studio. So let's start right with that. One of the first things when I saw your name in invasive cardiology, I hadn't seen that term in some time. Yeah. What is an invasive cardiologist? Is it different than, regular cardiology?
Sure. It's a little bit different. So basically, in cardiology, is split up into multiple fields. You have general cardiology, you have invasive and interventional. There's even EP, heart failure. There's many subspecialties and varieties of cardiology. And invasive cardiology is really there to, treat and prevent, which all cardiology really wants to do that at all cost, if possible, to prevent, the next, event or heart attack. But invasive cardiology is there to hopefully, prevent and diagnose, but also to be sure. And in that sense, we do cardiac caths or angiogram or procedures in order to diagnose, whether you've had a heart attack, you have significant disease, or if something needs to be intervened on in the future, like valve surgery or something like that. And we have a couple more tools at our disposal. So invasive cardiology kind of bridges the gap between, strictly non-invasive, medical treatment and, full-on intervention or surgery.
So could you say kind of like this? You're kind of like you survey the job that needs to be done. You go into the heart, you take a look, and then maybe if some plumbing needs to be done, like interventional cardiologist. I heard Dr. Agarwal once say he's the plumber of the heart.
Right. Yes. Exactly.
So you would work with him to provide that type of treatment.
Yeah. Exactly. So in cardiology, there are plumbers. There's also electricians too, and that's a separate topic. But basically, we're there to help along and diagnose the disease, because not all disease has to be treated with, you might have heard of a stent, like a cardiac stent that's placed in somebody to keep a vessel open. Nowadays, medications are so much better and more tailored to people's needs that some people don't even need stents anymore because they come with their own set of complications sometimes. And so sometimes just being able to diagnose it and treat it with medications is all you really need.
It's interesting you brought up stent. A few years ago, actually, my father had to have a stent. I didn't even know what it was, believe it or not, before I kind of got into healthcare PR. Right. And I learned a lot from that experience, him in the hospital, one day, and we were all really, scared about it, but it turned out it was just a normal procedure. So, and then now, fast forward a few years, I've seen some, drug-coated balloons inserted into veins. I'm seeing that in like the vascular. I had a vascular surgeon on recently, and it's gone so long. And to hear you say, sometimes stents aren't even needed anymore.
No, yeah, exactly, yeah. So nowadays, everything is going to minimally invasive if possible. Nowadays we can even do a valve, through through the percutaneous, so you don't have to crack it open your chest anymore. Open heart surgery, which things have moved to less invasive because we figured out that the treatments have gotten so good, the medications have gotten so good that we're able to treat most heart disease without having to do invasive surgery or invasive procedures anymore. And things have just evolved to the point that, that the improvements have, outproceeded, the need for intervention almost in some instances.
And that's great news for, future patients, because the shorter time you're in the hospital, less chance for infection. We've heard that. Minimally invasive.
Right.
Obviously, you can recover faster.
Right. And, all in all, with these procedures, usually, you're only in the hospital maybe a day or two at most, versus some days, if you did open heart surgery, it'd be 5 days to a week or something like that. And then obviously, if you're just treating medically, you don't even have to do, any procedure, maybe just the initial procedure. As a whole, in the past 10 years, heart attacks have been on the decline. They've gone down by almost 25%. So you don't see that gripping huge heart attack that you see anymore, where people are dropping dead in a sense. I mean, that era, that happens still, but it's a lot less frequent because the medications have gotten so much better and the treatments have gotten so much better and our diagnosis has gotten better. It's truly amazing.
Well, once again, that is great news. And we're here with Dr. M.Gardner. Kind of new to this area. You've been here 2 months, right?
Yeah, I've just been here 2 months. Moved down from Chicago. Trained up there outside in Franciscan Alliance. Did my internal medicine as well as cardiology up there, and so made it down here. So
nice. We're very happy to have you here, and we have a lot of doctors on this show from the Chicago is a great hub of medicine.
Right.
As well, I know that there's the New York City area is great. I see a lot of that on resumes. Baltimore, of course, because of Johns Hopkins, and Mayo up in Rochester and Cleveland. But man, there is a lot going on in Chicago in terms of education and training and in the medicine world.
There is. I mean, in Chicago, is a hotbed. I did a lot of my training as well at University of Chicago, specifically in heart failure and heart transplant is there. And that was an eye-opening experience there, because you really realize the breadth of cardiology and how far we've come, being able to, do that at University of Chicago, see heart transplants as well as the new mechanical assist devices and the treatment of heart failure, which has come way, way advanced in the past, really 5 years is where it's really coming to its own with now these mechanical devices as well. So, I mean, Chicago has been really a hotbed for especially some of the advanced therapies for heart failure as well.
Yeah, we talk a lot about the mechanical devices on the show and robotic surgery as well in other fields. Yeah. Mostly in other fields. But we did have Dr. Brian Bethay, actually 3 years ago, the first show I ever did right here. Dr. Bethay is a cardiac surgeon with Tenant Florida Physician Services, did the first LVAD in Palm Beach County, left ventricular assist device surgery. Yeah. I got it right.
Yeah.
So that was, he didn't do that 3 years ago. I think that was 2 years ago. But he was on this show, and that's right, exactly what you're talking about, those mechanical devices that have just been game changers. This man, I actually did a testimonial in this instance. I wrote the testimonial. This man would not be living today if it wasn't for that LVAD. He was on the end stage. And, what an amazing procedure that was. I'm going to tell you a little bit about Dr. Gardner. He's at Jupiter Cardiology Group up there in Jupiter. But you're, like you said, what hospitals are you on staff at? You're on staff, I know, at Palm Beach Gardens Medical Center, where I was born, and
Jupiter Medical Center.
And Jupiter Medical Center as well. Two great hospitals up there in northern Palm Beach County. What are some of the more common heart ailments you see in your office at Jupiter Cardiology Group? I know you've only been there 2 months. Right. And I think you started off with a lot of Medicare patients at first, but now you're branching out and opening your practice
and everything. So just here to the area, so just started seeing people, but with everything, the most common things we always see are hypertension. We see obviously coronary artery disease, hyperlipidemia, heart failure, and AFib are some of the most common things we see in practice, and those are all very important. And there's some of those, especially high blood pressure, coronary artery disease, and hyperlipidemia or high cholesterol are all things that are cornerstone of preventative treatment that we really strive for, and in cardiology to prevent the next thing. Those cornerstones, those three things. They make up atherosclerotic disease, which is the thing that, or the way that heart disease affects most of us. Heart disease is still the #1 leading killer in America, unfortunately.
Oh, wow.
Yeah, and so those things make up the cornerstone, and so that treatment and that preventative medicine that we use to prevent the worsening of those diseases entities is really what cardiology and the crux is based upon. It prevents heart attacks and strokes because that atherosclerosis, or buildup of plaque in the vessels, is what it leads to, strokes and heart attacks.
And is that also hardening of the vessels as well?
Yes. Over time, especially, as we age specifically, our vessels get much more hardened. They're not as compliant. They don't, and we become hypertensive, and our body just kind of doesn't react the same way it does before. And that's why you see that someone says, oh, well, now I have high blood pressure, now I have issues, and, they're, 50 years old, or they're starting to get older, 60, and as we get older, those, our vessels just kind of can't take the beating like they used to. So.
Well, I'm a prime example right here. Once I got over 40, man.
Yeah.
Because you carry a little extra weight, and that makes it, a lot of extra weight, but that makes it a little tougher. So
it does make it a little bit tougher.
Yeah, definitely. I've definitely felt it with the arthritis and some other issues as well. We talk a lot about AFib and COPD on this show, and this kind of leads into my next question. Obviously, AFib, you mentioned, you work with some electricians of the heart as well. Those are cardiac electrophysiologists.
Yes.
I know that from having a couple on the show.
Right.
Yeah, I do my research here.
There you go. Exactly.
I knew about the hardening of the arteries, too. So COPD we talk a lot about on this show.
Okay.
It's something I didn't even know about until 2 years ago. I had no idea what COPD was, to be honest with you. Chronic obstructive pulmonary disease. And this goes into my next question, because I had read about Barbara Bush when she had passed away. I looked what did she pass away from. Apparently she had COPD very bad and wasn't really taken care of, and it actually led to congestive heart failure, and that's what they're saying she passed away from.
Uh-huh.
And so what is congestive heart failure? I'm confused with that term.
Right.
Is that is that like an end all, or can that be can you be saved from congestive heart failure?
Yeah, you can be saved from congestive heart failure, and we talked about it a little bit earlier, but basic congestive heart failure, and specifically your question about COPD, is that some people with lungs that are very bad, or they're chronically hypoxic, they have low oxygen levels, which can result from various things, sleep apnea, smoking, what have you, and develop COPD. It can cause heart failure. It actually can cause right-sided heart failure. There are two sides of the heart, the right and the left, and the top and the bottom, but the right and the left are the two types of heart failure. And heart failure is a backup of fluid, or congestion of the vessels, sometimes in the lungs, sometimes in the rest of the body. And there are many medications that you can do to stop that process, slow it down, and sometimes reverse it as well.
Well, that's good to know, because when I read that and then I saw it as one of your areas of interest, I knew I had to ask you that. Dr. Gardner, hold that thought. We're going to be right back on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. we say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor Show. We're here with Dr. M.Gardner. This evening, he's an invasive cardiologist at Jupiter Cardiology Group, and then also with Tenet Florida Physician Services on staff at Palm Beach Gardens Medical Center, where I was born, so kudos to them. They did a good job. And Jupiter Medical Center as well, which everyone knows I'm from Jupiter, so I have high esteem for that hospital as well. My mom's been there a few times, and they've hit it out of the park. It's a great community hospital as well. Dr. Gardner, one of the questions, we talked a little bit about hypertension, and I was going to ask you, I kind of got a two-part question. I think doctors sometimes don't like that when I say that because it's so much to digest, but what exactly is hypertension? What are some of the symptoms? And is it on the rise? Because I had read something recently that it may be on the rise with baby boomers.
Right. So there's a lot to unpack with hypertension. It's a very complex disease. It may seem like something that's simple, but it truly is a silent killer in the sense that hypertension leads to a lot of other problems down the road. In fact, hypertension can lead to strokes, heart attacks. It can lead to heart failure. It can lead to AFib, some of the conditions that we talked about. So hypertension itself is basically where the tone or the pressure that's inside the blood vessels, specifically the arteries in the body, is elevated. Recently, there has been some debate and revision of guidelines that we use, and the guidelines are put out by different people, such as the American Heart Association, the American College of Cardiology, as well as the Joint National Committee. There used to be an old guideline about what blood pressure, a normal blood pressure is. Normal blood pressure in general is considered 120 over 80. And so the people that take their blood pressure may know what that means. Yeah. But an abnormal blood pressure, which was just revised in 2017, is anything above 130 over 80 is considered abnormal or high now. Okay? Now, about in 2015, there was a guideline that was put out called the JNC-8, and that guideline allowed people who were older, say 65 years or older, to have their blood pressure as high as 150 over 90. And so that number, has reduced drastically to 130 over 80. And that was from the SPRINT trial, which showed of 20,000 plus patients that the lower number was better. Now, the reason they had originally given people the ability to have like a higher blood pressure in the older individuals, specifically people older than 65, those people they thought may have more side effects from a low blood pressure, such as lightheadedness, or fainting, or feeling like they need to, sit down or something. But they found that those people still had a higher risk of, strokes and heart attacks when they allowed their blood pressure to remain high. So no matter what your age is, there's still a benefit to having a blood pressure that's controlled. So that's a little bit into why that is. But it is on the rise in general, as as we go on, as we age, as the baby boomers age. But it is definitely one of the leading causes of many issues.
That's a great explanation, Dr. Gardner. I couldn't ask you for anything more. That is fantastic, because I think we hear that term a lot, and we never take the time, unless we're in your office maybe, to kind of stop and think about what is hypertension and what are some of the signs and symptoms. I have another one for you, because this is one I see all the time, and I'm also confused about, and I think I like sitting in this chair because sometimes I get to ask the questions that maybe the general public have, and sure. We see it on your areas of interest and whatnot. Nuclear cardiology, and what are they doing with nuclear?
Right. So they're not making you glow. So what they're doing, basically, nuclear cardiology is, again, the push is to non-invasive, entities, and being able to diagnose something before it becomes a problem, and preventing the issues. And specifically nuclear cardiology, most of the time you're trying to prevent a heart attack. And what happens is that there are many types of stress tests you can do. You probably picture, the $6 million man running on a treadmill, or, someone doing that in the squiggly lines in the EKG. But nuclear cardiology uses a tracer, a radio tracer, usually technetium, to radio label your blood and see how it goes into the heart and distributes into the heart. And you can pick up on differences of blood flow. And where an area may have decreased blood flow compared to another one, that could indicate that there's heart disease or blockages in those arteries, and therefore you can intervene upon that if you need to.
Okay, so you could actually see on the screen. You're trained to do so. You can see actually what's going on with the blood going in and in the heart, in and out of the heart.
Right.
Maybe even if there's a leaky valve or something as well. Or am I going too far?
Well, I mean, the leaky valve, that's more of an echo, which is another non-invasive thing with ultrasound waves. But in nuclear cardiology, you're really looking at blood flow.
Okay,
so
blood flow.
So you're trying to really look at the blood vessels to see if there's any blockages in those vessels.
Okay, so you can see the blood going in and out of the heart, and you can see areas where, maybe if there's a blockage there, you're not seeing much going on.
Right,
there.
exactly. And so you're going to see.
Oh, wow.
If you can see that, you can kind of, in a sense, hopefully predict if someone's going to have a heart attack before they do, and hopefully intervene upon it before they have a heart attack.
Oh wow, that is very important. That is lifesaver. That you save people from like that widowmaker. We've heard that term. I hate that term because wow, that is definitely an artery blockage or a couple arteries being blocked, and then just the heart just doesn't have the blood flow. It stops.
It just stops. Yeah. So
that's it.
Yeah, that's it. And that's a myocardial infarction, and or also known as a heart attack. And that's all. A lot of times what we're trying to prevent in nuclear cardiology is prevent the next heart attack or prevent the first one.
Now, is that nuclear cardiology test? Is that done in the hospital or in the office?
It can be done in the office or the hospital, depending on your needs. But it can be done, in our office, for example, in Jupiter.
Okay, yeah, and it is called Jupiter Cardiology Group. I just want to make sure, right?
Right. Yeah.
Okay, yeah. With Tenet Florida Physician Services, I know we have a few different branding, different offices branded different ways, but with Tenet Florida Physician Services, it's tfpsdocs.com. If you want to check out any information on Dr. Gardner, he's got a profile there on tfpsdocs.com. It's TFPS DOCS. His education and trainings there, the areas of interest I mentioned, board certified by the American Osteopathic Board of Internal Medicine. So you are a DO.
Yeah.
We don't see that a lot too often in cardiology.
Right.
That's great.
Yeah, I am a DO. So it's a doctor of osteopathic medicine. So there's two types of doctors in the United States. There's DOs and there's MDs. DOs are actually on the rise, and they comprise almost 10 to 15% of all physicians in America. And the philosophy of osteopathic medicine, or DOs, is that you treat the body as a whole. You treat the whole person. So while I am a specialist, we want to treat the person and what can make you better and make you feel better. Because, of course, in health, we want to prevent as many things as possible. But ultimately, the point of health is to be able to live the life you want. And osteopathic medicine really tries to, strike the balance between quality of life and quantity of life. Meaning that quality, that you have a good, long, fulfilling life, that you're able to do what you want to do, especially in cardiology. Can you go play with your grandkids? Can you go, play tennis? Can you do the things that you love? And, quantity, are you taking too many medications or doing procedures which limit your ability to do what you really want, but you may live a little bit longer? And I think osteopathic medicine tries to balance that a little bit more than in balance that, and that's their kind of cornerstone that they're trying to do in osteopathic medicine, I think.
Yeah, that's great. And thanks for explaining that. And I just noticed something at your office. Dr. Vogel's also a DO, and I haven't seen a lot of cardiologists that are DO, so that's great to see. Dr. Gardner's in the office with Dr. Craig Vogel as a cardiologist, and Dr. Raul Agarwal, who I mentioned before, a friend of this program, been on a few times. He's kind of the plumber of the heart, the interventional cardiologist, does interventional procedures in the heart as well. We talked a little bit about echo, but I just had a little bit of a question. When is an echo needed? I know you kind of mentioned it before, but that's echocardiography? Right,
echocardiography. Basically, an echo is an ultrasound. So the ultrasound that you use basically to look at a baby, like if you're trying to look at to diagnose a pregnancy. It's the same ultrasound waves. It's non-invasive. It's use it on the chest to take a look at the heart to see if there's any evidence there of maybe some leaky valves, to see if there's any evidence that your heart may be weak, that you have congestive heart failure that we talked before, or even to see if there's any evidence of a previous heart attack and be able to diagnose a lot of different things actually by using a minimally invasive ultrasound wave, and you're able to diagnose a lot of things that way.
And right there in the office.
Right there in the office,
Yeah.
we do it there in the office, and it can be done, instantaneously. Like even if something was going on acutely, like something that day, we can take a look and see what's going on. It can also be used to help diagnose, blockages in the arteries as well. Sometimes we do our stress tests, like we talked about nuclear cardiology, but sometimes you're actually able to do an echo to see how the heart functions under stress and be able to diagnose many things like that as well.
That's great to know, and thanks for all these explanations. We only have about a minute. It's hard to believe ripped through 30 minutes. I always ask the last question, what are your hobbies and passions in life outside of medicine?
Well, I've got a beautiful daughter and a son, so they've been my passions. And then I always like to fish, actually, and hunt. So I like to little outdoors as well.
Yeah, I know you say you're from Alabama, so I get the hunting. You're in the right spot for fishing.
Yeah, no.
I'm from Jupiter, so let me know if you want to see anything up there. I grew up on the Loxahatchee River and Jupiter Inlet.
Yeah,
so,
they say the best friend you have is the one with the boat. So
yeah,
I'll take you up on it. So.
15-foot Lowe's roughneck with a 40 tiller motor on it. So
Nice.
We'll have to talk about that. Maybe we can go out. But thanks again for making the drive. It's great information. It's Dr. James Gardner, invasive cardiologist in Jupiter, 561-627-3130. Thanks again, Dr. Gardner.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests,